About Rabies by Shanna Linderman. We're going to start by looking at the classification and description, or the basics of rabies. Rabies is a viral pathogen which is classified under the family Rhabdoviridae and the genus Lyssavirus. It is considered an enveloped virus, which is constructed with a capsid packed with nucleic acid enclosed within a lipid layer. This layer is a phospholipid membrane, which is acquired from the virion buds from a host cell and can be intracellular or cytoplasmic. The capsid itself is helical or rod-shaped and roughly 180 nanometers long and 75 nanometers wide, which is larger than a protein but smaller than mitochondria. The rabies virus is also negative single-strand RNA. The picture shown is courtesy of the Center of Disease Control and Prevention and is going to show the shape of the virus, which is helical or bullet-shaped. You can also note where the envelope membrane, the RNA, and 2 of the 5 different types of encoded proteins. Start by looking at the details of the disease, including the transmission of the virus, affected areas of the body, common signs and symptoms, and incubation. The rabies virus is transmitted through the bite of an infected animal into the muscle or mucous membrane of another warm-blooded animal or human. From there, the virus then travels within the nerves to the brain and spinal cord, where it can multiply and eventually then migrate back to the salivary glands and saliva, where it can be transmitted again. The areas majorly affected by the rabies virus are the brain, central nervous system, and there's also some discomfort or itching at the site of the bite. Signs and symptoms. The beginning symptoms may be mistaken for flu-like symptoms such as weakness, discomfort, fever, and or headache. During this time, the victim may also experience a prickling, discomfort, or itching sensation at the bite area. The beginning symptoms may last for several days, and after this period, the symptoms will usually progress to brain dysfunction such as anxiety, confusion, irritability, or agitation. Progression of the disease eventually leads to more severe symptoms such as delirium, unusual or abnormal behavior, hallucinations, insomnia, and the telltale sign of rabies, which is hydrophobia or the fear of water. All of these symptoms are considered to be the acute period of the disease and will usually last between 2 and 10 days. And finally, the incubation period, or the time between the exposure and onset of symptoms. This can last for weeks or even months and will vary depending on a few different things. The first thing would be the location of the exposure site and its proximity to the brain, the particular strain of the rabies virus, and if the victims have any pre-existing immunity to the virus. Frequency, including susceptibility, morbidity, and mortality. The rabies virus can be found on all continents except Antarctica and has been recorded in more than 150 countries and territories around the world, with the majority of infections occurring in Asia and Africa. This is primarily going to be populations with low socioeconomic statuses who do not have ease of access to vaccines and treatments. Up to 99% of cases where the rabies virus has been transmitted to a human is through domestic dogs, either through licks with their saliva to previously open skin, or of course through a direct bite. Children ages 5 to 14 are actually the most common victims. There are some high-risk occupations that may choose a pre-exposure prophylaxis, or abbreviated PrEP. This is vaccination for people working in labs handling live rabies, or people who may be regularly exposed to known vectors such as wildlife workers or those who live in remote areas of the world. Once the symptoms are present, rabies is essentially 100% fatal. Rabies is the cause of death for tens of thousands of fatalities each year, as stated mostly in Asia and Africa, with at least 40% of these victims under the age of 15. Although rabies cases are rarely reported, the recorded numbers may vary largely from the estimated burden. In 2021, Africa recorded 15 deaths related to rabies. The Americas, including Cuba and Haiti, recorded 16, and Southeast Asia recorded 32. Rabies source and transmission. The source of rabies is considered zoonotic, meaning that the virus originates in non-human animals, or what is known as a zoonotic source. This is going to include, but not limited to, dogs, bats, raccoons, skunks, and foxes. Once it is transferred, the virus can then live in humans as a carrier type. The transferring or transmission is going to be through the infected animal contact, which can enter the body through broken skin. This can even be skin that was already broken, for example, a pre-existing scratch on the arm that was exposed and introduced to the saliva of an infected animal. But more commonly, the rabies virus is thought to be transmitted through a bite into unbroken skin by the infected domesticated or wild animal. Prevention is widely focused on vaccination of domestic pets and avoiding contacts, any kind of contact with wild animals. Right, therapy, treatment, and testing if applicable. So the therapy or treatment is only going to be helpful if administered before the onset of symptoms. This is called a post-exposure prophylaxis, or abbreviated PEP. This again needs to be administered immediately after exposure, and the main goal is just stopping the disease from spreading to the central nervous system and brain. There are 3 different steps or levels of PEP depending on the exposure. We'd be looking at some vigorous and thorough washing with soap and water for a minimum of 15 minutes, in addition to wound treatment, a series of rabies vaccinations, and then the rabies immunoglobulin or monoclonal antibodies directly injected into the wound. If vaccination is needed, it again is only effective if administered before the onset of symptoms. And victims with no prior vaccination status will need a total of 4 doses of the vaccine over 2 weeks, a 2-week period. And victims with prior vaccination status only require typically 2 doses. Testing can be very difficult unless there's a known contact with a confirmed rabid animal or the telltale sign of hydrophobia. There's currently no tools that are effective for detecting rabies infection before the onset of symptoms. However, after the onset of symptoms, multiple testing can be done, one of which is going to be a saliva test with the isolation of the virus done by RT-PCR. There's also one of the more reliable tests called a direct fluorescent antibody, or DFA test, that can be used with a stain. The rabies antigen will present as a fluorescent apple green area through a fluorescence microscope. That is fairly new as of January 2022 from the CDC. They've tried to raise awareness of the risks of rabies, particularly from bats in the United States. According to a press release from the CDC, In January 2022, there's been an increase of human rabies cases linked to bats in the United States, with 3 deaths, including 1 child, from September to November 2021. This brought the total number of cases in 2021 to 5, which is a significant increase compared to 0 reports of rabies-related cases in humans during 2019 and 2020.